So welcome everybody. This is the Indiana Coalition Network. And I'm going to share some slides with you just to open up the meeting today. My name is Lori Crosdell, and I am the LCC coordinator for Scott County, Indiana. And we're happy to have you on this. We've actually been doing these webinars since last June. We have one a month, and they are on the last Thursday of each month from 12 to 12:45. Hopefully you and your county have already onboarded with the Indiana Coalition Network. If you have not, send me an email and I will shoot you the information on how to easily do that. The form to onboard your coalition and your executive committee on your board and members of your board is very easy. It only takes about 3 minutes to complete. So we're excited today to we're going to be having several guest speakers today, and we're excited to have them. We're going to be talking about the naloxone boxes and Aaron's Place Camp and overdose response teams, as well as recovery community organizations. So our webinar topics today are being presented by Justin Phillips. If you don't know Justin Phillips, you should. She is a household name around Indiana, at least around Scott County. She's the executive director of Overdose Lifeline, and we are so excited to hear about naloxone boxes for Indiana counties. And we also have the executive director of Scott County's Recovery Community Organization, Thrive, here, Phil Stuckey. He is going to be talking about recovery community organizations and Scott County's overdose response team. And then, of course, Corey Smith. Everybody who's an LCC knows he's our manager at the Indiana Criminal Justice Institute in the Behavioral Health Division, and he's going to be sharing about news and updates. As you guys know, this is a busy time of year for those of us who are LCCs. We have our comprehensive community plans due on April 1st, and our last quarterly report due on April 15th. So I'm sure he's going to be talking about a couple of those things. So here's the website. If you haven't already checked it out, hopefully you will, for the Indiana Coalition Network. And as always, we have got room for more. We have 57 counties who have now onboarded, and we are looking for more. So there's the email where you can send, if you want the coalition onboarding form, or you can email me. You probably all know my email because you received this invite. But the counties who have stars are now onboarded members, and the counties that have the little webcams are counties who have attended at least one of our webinars. So we do have a really good representation, and it's kind of spread out fairly evenly throughout the state. So we're excited about that. So without further ado, I'm going to stop sharing my screen, and Justin is going to share her screen. And Justin, the floor is yours.
All right, good afternoon. Justin Phillips. I'm the founder and executive director of Overdose Lifeline, and thanks all of you for showing up today and all the important work that you do. In a previous life, I worked at the Indiana Criminal Justice Institute in the Traffic Safety Division, but I'm very familiar with the local coordinating councils and all the great work that everyone does. So thank you for being here today. We Overdose Lifeline, in case you've not heard of us, we're a nonprofit. We're based in Indianapolis, but we serve the state of Indiana. And we actually have about 400 partners in 28 other states across the country. We really are trying to change the approach to substance use disorder. And our main focus has been around the opioid overdose epidemic and crisis that has existed. Again, we were founded in 2014. So my background is in injury prevention and public health, and So when I had a significant life event with my child, Aaron, in 2013, it was just a natural place to try to move my skills and talents over to try to helping prevent additional deaths from overdose. So today I'm really just talking about two things that we do, but I snuck another one in just because so many of you are here. Briefly, when I'm talking about naloxone and naloxone access, and more specifically Nalox boxes. So just in case everyone isn't aware, because I'm surprised to find that people aren't always aware, we do have this law in Indiana that allows for over-the-counter naloxone, which is the overdose reversal drug, without a prescription. And you can go into any pharmacy in the state of Indiana and get naloxone without a prescription. And so it's important to understand that. It's important also to understand that there are Good Samaritan protections in that law that protect you, provided that you follow the law, which includes calling 911. So naloxone distribution falls under our line of business called support. And if you're not aware, the governor's office gave us some significant funding, the Division of Mental Health and Addiction, in June of 2020 to provide naloxone to anyone that needs it without any significant barrier by simply going to a link on our website. We also have about 50 plus community distribution entities across the state in lots of different counties that distribute naloxone with our assistance at the community level. So if that's not occurring in your county, or you're curious about how to get involved with that, please let us know, because we do believe in grassroots distribution of naloxone and little to no barrier. The second part of that funding is the Nalox Box project. And a Nalox Box looks like this, but here's the challenge with the virtual background. So hold on. Can we fix that?
I think if you put it up real close to the screen.
There, look, I fixed it. This is what a Nalox Box looks like. Okay, so it's a very hard, very heavy duty acrylic box that has a closing mechanism, but it is not intended to be locked. As you can see on the outside of the box, there's a phone number if the box is empty, as well as recognition of overdose symptoms and how to respond. So this is a project that was launched out of the state of Rhode Island by some really clever emergency room physicians. And the intention of the Division of Mental Health and Addiction and Overdose Lifeline is to put 1 to 2 to maybe more, depending on the county, into the community, so that there is never a barrier to access naloxone. So this box access doesn't require interaction with a human, doesn't require the business to be open during business hours. We know that it's not always possible to get to our public health department between 9 and 2 on a Tuesday afternoon. And we also know that people feel the shame and stigma still from opioid use disorder and don't want to interact with, say, a pharmacist. So these boxes are being placed in counties. We, again, as I mentioned, we have funding for 2 per county, and some counties require more, like Lake County and Vanderbilt County and Marion County, depending on the overdose. We have established a great deal of community partnerships already for a number of counties, but we're still always looking for more. And all we ask is, if you aren't already doing a Nalox Box in your community, or you want more information, that you consider a public space that wouldn't present a barrier. So though we appreciate some of the well-meaning requests, we aren't really thinking it's a good idea to put in a Nalox Box at the courthouse, and we're not thinking it's a good idea to put in a Nalox Box at the police department. But where instead is a place where people will not be afraid to visit the box to get the naloxone. And then the community partner will help us make sure that the Nalox Box is not empty, but we do have that phone number on there that I mentioned. In the event that you the box is empty, you can call that number, and then we can get you a kit out right away via the USPS mail. So that is the Nalox Box, and I think we'll wait till later for questions. Is that fair, Lori?
Sure. That's fine.
Okay. The next thing I just wanted to touch on is that we have this evidence-based support program for families, and this training to be trained to facilitate a craft group is free through the Division of Mental Health and Addiction. So if anyone is interested in starting this peer-to-peer family support group within your community, please do get in touch with Overdose Lifeline. Now, this is the link really quick that you can see at the top of the Overdose Lifeline website, where you can easily request naloxone or refer individuals for that request. So I wanted you to have that. The second thing I wanted to talk about that we're so excited about is bringing a national model to Indianapolis called Camp Mariposa. And Camp Mariposa is part of the Aluna Network, which is a national foundation. Camp Mariposa is a model for children ages 9 to 12 who have substance use disorder within their family. So really these, unfortunately, are the forgotten group of people affected by someone's substance use disorder. And this model is approved by the Office of Juvenile Justice and Drug Prevention, OJJDP, as a prevention intervention program to reduce substance misuse amongst youth and also juvenile justice involvement. So the kids come to what is called camp, but it's not a traditional camp. It's a year-long engagement. They are matched up with a mentor. The mentors are highly trained and important part of the process. As we all know, all of us, no matter what our background, can use a mentor of some sort. And we engage with the youth every other month from Friday to Sunday in a traditional camp experience, while interweaving therapeutic intervention around substance use disorder, providing them with a community of other kids who also have their same shared experience. So much like peer recovery coaches are important for an individual's recovery, this camp is an important piece of healing kids who've been affected by substance use disorder. When we're not at camp, we are engaged on those off months in a family intervention activity that has a therapeutic component, but also a fun component. So obviously, we're in Indianapolis for this camp, so some of you maybe are too far, but we still are enrolling campers. Justin, if you know me at all, never says no. So if you have a kid that seems far away from Indianapolis, I will try to make it work. Since it is, a short amount of time, we have been raising money for transportation stipends. So please do let us know if you have an interest in Camp Mariposa. The application, all the information is on our website at this link I've provided here. You can find it under the Overdose Lifeline support programs. And it's free, okay? So that's the thing I sometimes forget to say, but everything is free for the child. And we will have everything that child needs, including sleeping bags, flashlights, backpacks, water bottles, everything. All the child has to do is bring their beautiful self. So really excited about the impact that we're going to have on some kids in Indiana from this camp. Just as an FYI, and then I'll be quiet, Lori, we have some funding through the Anthem Foundation to provide some of our programming and training for free. So I need to throw that out there. If you're interested in some of our youth programs, this is not about drugs and Preventure. Preventure is a selective program. It's evidence-based for high-risk kids. And we have adult programming. We have a 20-hour certificate available with continuing education units for clinicians and non-clinicians. So we have the ability to fund some of this for certain counties in Indiana. And if you have an interest or a curiosity about accessing some of these programmings under this grant funding, please get in touch and let me know. This is our website. This is how you can get in touch with us or receive our monthly newsletter. And this is my email. And I appreciate the opportunity to be with you today, and I will stop sharing.
Thank you, Justin, so much. That was awesome. We appreciate that great information. Phil, if you would like to go ahead and share your screen. I work very closely with Phil in Scott County. Phil Stuckey is the executive director of the Scott County Thrive Recovery Community Organization. And he's been doing phenomenal work in that area, as well as started doing the great work of starting the Scott County Overdose Response Team. So Phil, going to turn it over to you.
Hey, thank you very much, Lori, and I appreciate the opportunity, you guys letting me come on here. Such amazing work that you guys are doing, especially the collaboration with all the counties. So hopefully I'll get through this quick. I'll just go ahead and get started. My name is Phil Stuckey. I'm the Executive Director of Thrive. And we're going to kind of just go over two quick things real quick, kind of what RCOs are, kind of how they get started, and then kind of what the services that we do at our RCO. Let me make sure you see everything okay, Lori?
Yes.
Okay. So what is an RCO? It is a recovery community organization that are independent nonprofit organizations led by local recovery allies. Allies may be people in long-term recovery, families, friends, or recovery-focused professionals or concerned citizens with an interest in providing support. I pull a lot of information. We work very closely with the Indiana Recovery Network. And I like how they put it, that it's created by individuals and families in recovery to provide support and service that are often unmet within their communities while decreasing the feelings of isolation and shame often experienced by people and families in recovery. What do? They increase the visibility and influence of the recovery community, advocacy activities, recovery-focused education within the community, and outreach programs. They kind of have three core elements: the recovery vision, the authenticity of voice, and the independence. So it's sometimes it gets easy to do that mission creep a little bit away when you focus on something, but staying true to your vision. The authenticity of voice for me is the diversity of people with multiple pathways in recovery. And we're not just talking about recovery from substance use disorders. We're talking about mental health. We're talking about family and friends, because we all know that, addiction in any form is a family disease. It affects so much of the family. And of course, the independence of where we strive to be a standalone entity outside of the silos of normal substance use or treatment facilities. So that way we can, we like to say we are helping our community without barriers, right? And so I will then tell you kind of a little bit about Thrive. So Thrive is an acronym. It stands for Teach, Heal, Recover, Involve, Value, and Encourage. It took us probably about 3 months to finally stick on a certain acronym to come up with our missions, bylaws. It was a very lengthy process, but very much worth the time and energy we put into it. Our mission is to support a healthy transition to recovery by creating awareness, overcoming barriers, and advocating for a safe and compassionate community. Our vision is to be an effective and intentional community, working together to educate, support, and advocate for recovery for all. And our hope is that Thrive's Recovery Community Organization will educate, support, and advocates recovery for all in order to support a healthy transition to recovery. I'm just gonna, this is opening day. So we started on this program back in 2016, because if you've heard of Scott County, you've heard of the HIV epidemic. And kind of, we were born out of a coalition that got together and said, what does our community needs? And thank goodness they did, because they found that there was a lot of issues. So they asked us to get the community and stakeholders got together, and that's how we were born. September 28th, we got our opening day, our brick and mortar building that we have. We have fun in recovery. One thing that we have found is that you need to get the community involved. You need to have the good, right partners, and you need to get stakeholders involved. As you can see, our opening day was a huge success. A lot of people, this is, I'm going to say, the pre-COVID days. So we were allowed to sit 6 inches from each other. Some of the partners we have in this picture is Brandon George, the Vice President of Mental Health America, Indiana, and with the Indiana Addictions Issues Coalition. I'm sure most of you all have met Brandon at some point, or at least heard him speak. And then, of course, having, some local law enforcement to come down and be a part of it. Kind of how we have started our board when we first started out is we wanted at least 51% of our board to be in recovery. And then we got an amazing group of community stakeholders to be on board. We actually have one of our local law enforcement, the chief of police, is on our board. We have community corrections. We have families and people themselves that identify in recovery on our board. It's a very diverse population. Some of the things that we offer, and I like how Justin put it's 100% free. That's kind of what everything, all the services that we offer are 100% free to the client. We don't bill insurance companies. We're paid out of a grant through SAMHSA to give free services. The engagement center is, we have it open all week. And of course, at Friday nights, we have one of our coaches have a family night. So you can bring your kids, they get a supper and a movie together, or they play euchre, which if you're not from Indiana and you're a transplant here, if you don't know what euchre is, I'll give you my contact information and we can talk after this. We do HIV and Hep C testing there at the facility. We have partnered with Overdose Lifeline to become a Narcan distribution site. We do have and have made our plans, and we have the location set for our Narcan boxes. Thank you so much, Justin, for that. We have peer support meetings there, 12-step, any self-help. We're very inclusive. We believe there's multiple pathways that need to be encouraged. We do MAT induction within 24 hours. So if we meet with somebody, we've partnered with some local providers to where we'll actually do a telehealth induction. We actually have a community health nurse that will make sure if someone needs to be cleared for inpatient. We not only do SUD, but we also do mental health induction for medication, and we also have resources for that. I'm going to touch on this just very quickly, but we do have an overdose response team, and I'll get into that in just a second. And of course, we've partnered with FSSA, and we work on the 211 line. So if you go to option 2, then option 6, you can actually talk to a peer recovery coach free of charge. And we also have an app that someone can use anonymously if they want to locate a recovery coach in their community. Let's see. So kind of where I said our funding our majority of our funding comes from is the Regional Recovery Hub that we've partnered with DMHA, FSSA, and MHAI. And Thrive is an anchor hub for the Southeast region. I don't think my cursor is very big, but kind of the Southeast region, if you can see, is kind of everything that kind of goes around Indianapolis, right? So everything that's kind of Marion County and Johnson, but then we kind of have Henry and Wayne that go up there. And then we kind of come down, I call it the 65 corridor. So any county that's on that line, we cover that as well. We have 25 certified peer recovery coaches on staff. That's through all 21 counties. We also have a satellite hub that works over in Dearborn. And like I said, the app that we have is with the IRN Peers app. It's on Android and iOS. If you talk to people and get the app, it's a free app, and they can just create an account completely free, and they can reach out and they'll get in touch with a certified coach immediately. It's a really cool option for people, especially with a lot of the population we serve don't have a lot of minutes or data on their phones. So it's something they can just use with Wi-Fi. I will talk about our overdose response team. What we've done here is we've partnered with 3 local police departments in Scott County, Scottsburg PD, Austin PD, and the Scott County Department, Sheriff's Department. We also went up to our local prosecutor and talked to them about the project before we started. And what we do with the overdose response team is if there is an overdose, we get we have a team, they get the phone call, and if they're going to be incarcerated, we'll actually go to the jail within 24 hours and meet with the client through telehealth if they're asking for help and resources and treatment. If a lot of times people get Narcan and then they say, I don't want no more help, and they walk away. We all know, and this has been said many of times, that people can still fall back out in that overdose, the same injection 3 to 4 hours later without medical clearance. So if that is a situation and someone says they want help, we'll actually send a coach to that person, and they'll stay with them and help them out in any ways and try to get them connected with resources. it's another way we work is with right now it's with one hospital we have the MOU with, and that's Scott Memorial, where we actually had just another one the other night where an ED physician called us, and we sent up a recovery coach that went into the ED, talked to him, and I can tell you all that person went into treatment this morning.
Wow.
So just it's an amazing program that we do. We got to I think altogether it was around 90 different officers we got to help train. We got to give them Narcan training as well. We had Justin Phillips come down and speak on Aaron's Law and what ODO offers. And then we got to tell them a little bit about the program. It's been an amazing program so far. We don't have enough traction or time to give you what the data looks like. We started it about a month ago. But so far, fingers crossed, so far everybody we've gotten into treatment has stayed in treatment. So that's about it. Hopefully I didn't go over my time Lori gave me. I don't know how you handle with questions. If you have any questions, I'll just say, I'll give you my contact info. If there's not time, you can get a hold of me. There's my email there, our website, and my cell phone number if you need to get a hold of me for anything or have any questions. And I'll tell you the biggest thing that worked for us when we started our RCO is we didn't try to reinvent the wheel of an RCO. We actually went to Indiana Recovery Network. We went to Indiana Addictions Issues Coalition, and we said, help us. And they sent down some amazing people. I will say this, one of the first founders that helped us get started, Mr. Tom Cox, has passed away. But I can't talk about our RCO without talking about him. And so Brandon George, Heather Rodriguez, all those people, they came down and they really helped us get invested and tell us the steps to keep the sustainability. So that's all the information I have. And I will do as Justin, and I will be quiet.
So I'd like to open it up because actually, Phil, you finished early. Does anyone have any questions for Phil or Justin before we open it up to Corey? You can unmute.
Yes, I would like to know, I'm in Marion County. I'm not sure where the boxes are located. Where would I find that out?
Sure. Thanks for the question. So I put an email address in the chat for Amanda. It's amanda@overdoselifeline.org. We haven't placed boxes in specific locations yet in Marion County. We have some requests. We're working with the Marion County Health Department to determine locations based on the heat map of EMS runs, which we ask all communities to look at the Indiana State Department of Health heat map to determine where overdoses are most likely occurring. We're also working with the city of Indianapolis on some locations, but we would welcome Drug-Free Marion County's input if that's part of what you want to do. So please do email us.
Thank you.
You're welcome.
I'd like to share that we actually allowed our recovery community organization Thrive to determine where our naloxone boxes were going to go in Scott County. And they chose the Scottsburg location of the Recovery Engagement Center as one location. And then the other location is on the north end of Austin at the Jace Ray Stallings Youth Center. So if you can involve your recovery community in that as an LCC to help you to determine the best locations, I would encourage you to do that as well.
Thank you.
We have surely appreciated partnering with the Indiana Recovery Network and the Indiana Addictions Issues Coalition on getting our recovery community organization up and running. I know that you all, they'd be happy to help you out as well. Jody is on this. Jody, do you guys see Jody? There she is. Jody Miller. She's also with Hamilton County. She is the Deputy Director of the Indiana Addictions Issues Coalition. If you want to chat with her and ask her and reach out to her, I'd encourage you to do that.
I'll put my email address in the chat.
Thanks, Jody.
Well,
So,
Lori, one thing I was going to say, just, one thing that when we got with the IRN and IAIC is the biggest thing they told us is it needs to be a grassroots program. And what that means is they can have this model that works great in Marion County. It's not going to fit Scott County, or it's not going to fit Clark County. It's not going to fit Gary. It needs to have the involvement of the community, because every county and every community knows they have different needs than the ones next door. So just know that, and that was very helpful information for us.
Another thing that we did, we called on assistance from GLATSI, the Great Lakes Addiction Technology Transfer Center. And they took our board members of Thrive through a one-day boot camp, RCO boot camp. And that was very helpful in terms of formulating our RCO and getting everyone on board with how it should function. So I would encourage you to reach out to GLATSI. You can just type in Great Lakes. I'll put it in the chat box. So we'll have some time at the end for if you think of additional questions. And I also like to ask you some questions to get your feedback on a couple things. But before we do that, I want to turn it over to Corey Smith with the Indiana Criminal Justice Institute. Welcome, Corey.
Hello, hello, hello. Hopefully everybody can hear me okay.
Yes.
All right, perfect. Okay, so I'll keep this short. I really have just 5 minutes. I just want to thank you all for allowing us to come in here and provide you with some updates from ICJI about what's going on our end. Also some important dates and whatnot. So really there's just 4 things that I want to discuss. It's going to be about the quarterly reports, comprehensive community plan, the basically communication that we have with state partners, and also upcoming ICJI research. First, let's go ahead and start off with the quarterly reports. Since the last time we spoke back in February, just wanted to inform you all that we have finished our third quarter report evaluations, and there should have been feedback provided to all of you on that. If you didn't receive feedback, reach out to myself or Sadia and ask as to why that didn't happen. But everybody should have been provided some feedback. But next really thing I want to discuss is the end of the year report, which is also known as quarter 4 report. Okay, that'll be due on April 15th. So yesterday on March 24th, we provided an email to all the LCCs that included the end of year report template, an example of how to complete the report. It's really split into two different sections. The first section is a summary of the programs that were funded throughout the 2020 year, which is something that has been done on each of the preceding reports. And then the second section is really the evaluation section, where the LCC will report on if it met its goals identified in the CCP, why it did not meet those goals, and how it will adjust the future to make the goals more attainable. Now, for those that didn't achieve those goals, we're not asking for LCCs to provide a detailed description of how it will adjust, but rather a generalized statement of a few sentences to show that the LCC has identified the issue and how it is working towards improving any hurdles that hindered its efforts in this past year, which obviously I know COVID is going to be a big one. So we're expecting that, understandable. But when you get the chance, take a look at the template that I sent out, as well as the example, and that should give you an indication of how to complete it. It's pretty simple. Next topic is the CCP. As you all know, the 2021 CCP submission is due on April 1st, and this will be done in IntelliGrants, just as it was the year previously. The submission window actually opened this morning, and we sent an email out this morning with instructions on how to submit the plan in IntelliGrants. If for some reason you didn't receive that email, reach out to Sadia or myself, and we'll be happy to forward that over to you. When we do the review of the CCP, it will be a side-by-side review, and we'll compare that to the previous year CCP. What we're looking for is just any minor adjustments in your SMART goals, and if you want to do a whole revamp, that's fine, but we're just going to do that comparison because it is a living document that we're expecting to see minor changes from year to year that reflect the changes of the community. There's also a CCP checklist that I sent out as well. So if you need to take a look at that, I'll be happy to send that out to you. Just contact me. As far as ICJI research, Megan Brandt, she's been the researcher that has worked directly with our division, and she's conducted the LCC annual survey as well as the focus groups. She's actually leaving the agency, which is unfortunate, but it's all right. She's moving on to bigger and better things. So With that being said, we are still having the annual survey that will be actually delivered to you all on April 5th. Okay, and that survey will be delivered via SurveyMonkey, and it will be titled 2021 Local Coordinating Council Survey. So just keep an eye out for that. And just know that really the purpose of the survey is for ICJI to have the most recent and relevant information about local coordinating councils to help us appropriately shape technical assistance and training efforts. So it's expected to be about 30 questions long and take about 10 minutes to fill out. And then lastly, we are still having continuous meetings with other state agencies in order to ensure that we have a common operating picture of programs and efforts that are going on throughout the state. Now, our mission is to bring LCCs into the conversation on any of those efforts related to substance use prevention, treatment, and justice services. So we make a good faith effort to relay these opportunities and useful information to you all, although sometimes there is some information that we do not receive from other agencies that are not brought to our attention, and therefore we cannot relay that to you. With these meetings, we're trying to mitigate that from happening. So, but once we're made aware of the information, we'll disseminate it out to you all through our behavioral health listserv. So really that's all that I have. If you have any questions or concerns, just reach out to Sadia or myself, and we'll do our best to answer your questions. If you have any questions about the CCP, I would ask as soon as possible because our inboxes are filling up. So in order to properly answer your questions in I guess in a good amount of time, just send those questions off to us as soon as possible. Otherwise, the later you wait, the longer it's probably going to take for us to respond, just because the more we get in, the less time we have. So really, that's it.
Thanks, Corey. Before we go around the Zoom and before I ask you all a few questions, does anybody have any questions for Phil or Justin before we end that part of it? Any other questions for Phil or Justin? Well, thanks again, Phil and Justin, for being on the call. And I want to ask you LCC coordinators and leaders a couple questions. First of all, I'm excited to announce that we've got some really good topics for some upcoming webinars. In April, we're going to be hosting Cyrilla Blackman from the Indiana Division of Mental Health and Addiction. She'll be talking about our Indiana Prevention Hubs. In May, Kim Linkle with Coalition for a Drug-Free Batesville will be talking about the nuts and bolts of coalition work. In June, we're going to talk about a subject that I'll ask you about in a second. In August, we're going to be hosting Doug Hunsinger from the governor's office. He'll be talking about the next level recovery updates and initiatives. And in October, Kim Linkle with Coalition for a Drug-Free Batesville will also be talking about engaging the hard to reach sectors for your coalition. So we've still got, are working on July and September and November, December. So if you have any suggestions, please shoot them my way. Some future webinar topics, someone had mentioned school system struggles and how to continue our community-based prevention work in the schools despite our COVID struggles and limitations. So if you, and we don't really want to keep just featuring Scott County agencies and organizations. So if you feel like you or a school system in your area could talk about that, if you want to shoot that our way, we'd love to get your feedback. Again, school system struggles and how to continue our community-based prevention work in our schools despite the struggles and limitations that have been placed upon us by COVID. So that's one topic. And then another question that we have for you, and we'd like to get your feedback now. Where are you finding places for yourself and your coalition members to continue receiving training in the areas of prevention, education, treatment, intervention, recovery, and justice and law enforcement? I know a lot of us have been attending the Great Lakes Prevention Technology Transfer Center webinars, but where are some of the other places that you guys are finding great places for you and your coalition to receive training. If you'd like to unmute yourself, please, and share, that would be great.
Real quick, I'll just share. Oh, I push, this is Krista Detzel from Hendricks County, and I push a lot of the ACEs connections. They have a lot of different free webinars out there, trauma-informed focus. And so I try to push those out and or attend those as much as possible.
Would you mind shooting me information on that website? And we'll be sure and put that on our on the Indiana Coalition Network under our resources. Thank you. Any others?
Yes, with our coalition, Marion County Prevention Alliance, we took a survey and asked, we listed 3 things that they wanted to talk about and ranked them in order. And actually, the first one was ACEs. So we went to the website and was able to schedule a presentation. And one thing good about their website is that they give you how much time you want them to present. So it's like 20 minutes, an hour, hour and a half. And so we had to get the one that fits our structure with our LCC meetings. So that's actually will be our first one that we'll have in June. And then we plan to do quarterly trainings because that's what the coalition has asked for from us.
So was that site that you all went to the ACEs connection as well?
Yes.
Okay, great. Thank you. That's awesome. Another, I know another organization that offers trauma-informed care training that we've used is the Community Resilience Initiative out of Walla Walla, Washington. So that's another one that was good as well.
Will you send us this information as well?
Sure. Yep, I sure will. Would you like me to just put it in the chat box or just email it out to you?
Email if you would, because
Okay.
the list of the presenters, Cirilla, that information as well.
Okay, sure will. We'll send out a follow-up after the webinar and we'll make sure to include all that information in it. Any thoughts about the school question, the school system issues? I know we haven't been able to do a lot of our things that we usually do in the schools because of COVID, and we'd like to hear from our schools about.
Do you guys have anyone in the schools? Like, is this, so it's just your community-based people that can't do things, right? Are there still people able to work in the schools, like school-based?
Yes, it's the community, it's the individuals that are part of the coalition that go into the schools. Yeah.
Okay, so my position is a community-based prevention specialist. So the way our team had to work for COVID is we had to put 1 person per school with no cross-contamination.
Oh.
And so I've just had to really heavily rely on them also taking my projects into the schools. They've had to be the lead of anything we do in the community. Every year, the LCC sponsors a Not With My Life campaign. And like this year's topic was vaping. It's a poster contest and the League of Women Voters here give them money. So like that's a huge thing where we work with the local college, local radio stations, things like that. So that was really hard to get into the schools because our school-based people don't normally know those narratives. So we just had to cross-train and really have them help us get our information into the schools and then report back to us out of the schools.
Okay.
Because I couldn't get past the front door on a lot of things. So
Right.
I think a lot of things still happened. Those people just would have to lead it or maybe do extra time at the basketball games and things like that since they were allowed in the school.
Gotcha. Thanks, Chelsea.
Or, oh, go ahead.
Only one of the things that I did, I visited all the superintendents and all the principals in our county, and we identified a person as a contact person in each of the school system. And so they're sort of our partner for that school. And so they have, like they just had a group meeting by Zooming, you know what I mean, with each other and talking about ideas. And so that's worked because by going through them, and they know each school is a little bit different, but we can still do the reaching, and we've been able to do not everything, but we've got things going. But by having that one person in each school that's our lead contact.
Okay. Interesting. Thank you. And we understand, some people have to run to other meetings, but we'd like, if you can stay on and continue networking, we would love to have you. There's a couple things in the chat box. Chelsea Robling from Knox County shared, they also have guidance counselors from their county schools attend their LCC meetings, and that's another way to keep the community prevention in the schools. That's awesome. One thing that Jody put, the Indiana Recovery Network will be offering RCO boot camps. So she's going to follow up with dates and how to register. So her email is in the chat box. That's awesome. So we don't even have to go to our Great Lakes Addiction Technology Transfer Center. We can get that done by some of our state partners. So that's awesome too. Appreciate that, Jody. Does anybody else have anything that they'd like to share? Any other places that you're receiving training from that we haven't mentioned?
I'll talk again, but I find it advantageous to cross sectors and go to violence prevention trainings, because a lot of times we share the same protective factors, even though there's two risk factors. And one of those that offers good trainings is called Prevent Connect. Sometimes they're really heavily embedded for advocates, but a lot of times there is a prevention track. So all of the Indiana coalitions against domestic violence, sexual assault, those type of places, they do offer prevention and they have good information.
Okay, that's great. And we'll make sure that these places are also put on the Indiana Coalition Network. So you'll be able to look up these resources on there. So make sure you do that. Any others? I know those of you who, if your community, your county is also block grant funded through DMHA, you have a lot of required trainings that you have to attend. I think some of those are provided by Prevention Insights. Any others?
The Preventure program through Overdose Lifeline that Justin Phillips had mentioned briefly on earlier. It's an excellent program, and I was trained, received my training through them on that for the schools.
That is an excellent program. Yeah, I've been trained in that as well, and we've conducted that at both of our high schools, or a middle school and a high school. All right. Well, thank you all very much for coming today. It's been great to see you. Stay warm on this cool, rainy spring day, and we'll see you all next month on the last Thursday of April. Y'all have a good rest of the week and have a great weekend. Thank you for coming. Bye.